2000 through 2021, there were over 270,000 Hispanic Latinx people living with HIV in the United States. That's a quarter of all the U.S., a quarter of all the people living with U.S. in HIV in the United States. Uh, and at the same time, in 2021, 29% of new HIV diagnoses were among Hispanic Latinx people, although Hispanic Latinx people only make up 19% of the US population. So when we see a group that's about 1 in 5 of the population, but about 1 in 3 of new HIV diagnoses, that tells us that there's really a disproportionate impact. About 19% of all HIV-related deaths in the United States were among Hispanic Latinx people, and 17% of PrEP users were Latinx, despite making up 29% of new diagnoses. And that's another situation where if Latinx communities are experiencing 29% of new HIV diagnoses, then what would be equitable would be for 29% of PrEP users to be Hispanic Latinx. And so we'll get a little more quantitative about this, but right out of the gate, it's clear that Hispanic Latinx communities are being underserved by PrEP. So I'll talk a little bit about AIDS View. So AIDS View is a website. It's freely available. It's a public data resource, and it allows you to see data about the HIV epidemic in the ways that are most relevant to the work that you do. And so starting on this is the landing page you'll find if you go to aidsview.org. And at the starting page here, you can see that you can view data by city, county, or state. Here we're looking at a county view. And I'm going to walk through some of the different kinds of measures that you can use. But I think whether you're trying to do education, whether you're trying to write grants, whether you're trying to figure out where is the best place to put a new PrEP service point to reach the people who are in most need of PrEP, I hope that the site will offer you some resources that help you do that in a way that, that makes sense. I worked at CDC, as Luis mentioned, for many years, and we produced reports that that had big tables of data and numbers. And for some people, that's exactly how some people want to get data about the epidemic. But for others, a map sort of gives different information and tells a different story. So you can look at maps by state, county, or at the city level, and we'll look at some examples of all of these. The one thing I'd like to point out just at the very beginning is that we think, for example, of Georgia, where I live, as being a heavily impacted state. But even within Georgia, there are real areas of greater and lesser concentration. So I'm going to see if I can use my pointer here in Zoom. Maybe not. So, in the north part of Georgia, that dark cluster of counties is Atlanta. But some people are surprised to see that going through the southern part of Georgia, we have counties that are in that same highest 10% of impact in the whole country that are in rural areas of Georgia. And obviously, there are very different kinds of services needed in Atlanta and in rural areas. And then within cities, all the way on the right, this is a map of Atlanta at the zip code level. And we often say all prevention is local, meaning that not the same educational or prevention materials or services work in the same in every part of our country. But within the city, it's down to the level of zip codes, and there are really a big spread within a city about where services might be most needed. And then we can take that view, for example, I'm just going to go back one slide and show you this view of Atlanta, but we can further break that down by race ethnicity. And what I want to highlight is that although Atlanta overall is a heavily impacted city, that differs in the impact among white non-Hispanic persons on the left, Hispanic Latinx persons in the next one over, and Black Atlantans on the right. and Asian Pacific Islanders are illustrated on the farthest right panel. And so it's not just that there's a greater level of impact, but that some of the particular zip codes may be heavily impacted in one community and not another. And this is all information that we need to figure out where our resources and our prevention and our treatment services can do the most good. So we have the HIV data by zip code for over 40 cities. They're noted on this map, and all of these are data that you can sort of go on and see in that sort of map format, or find data downloads for your own work. There are two ways that we display data about PrEP use. And one is just kind of the rate of people using PrEP. And that's on the left-hand panel. And so darker green areas here indicate sort of higher rates of people using PrEP. And we would expect and hope that the South would be an area where many counties are in that highest level of PrEP use, because the epidemic need is greatest in the South. On the right is a different kind of measure, which we'll talk some more about, which is called the PrEP to need ratio. And you remember earlier I pointed out that the fact that Hispanic Latinx people make up 19% of the population, but 29% of the new diagnoses represents a health inequity. Along those same lines, we would like to see that if that within a particular group, for example, Hispanic Latinx people, that the proportion of people benefiting from PrEP is the same as the proportion of new diagnoses. So we're going to go into this a little bit more, but here on the right, the darker colors represent areas where there's more equitable PrEP use. In other words, where there's a closer match of the proportion of the epidemic that's in a group and the proportion of PrEP use that they are receiving. So darker colors indicate more equitable use, and lighter colors indicate gaps in equity where a population is really being underserved. So whatever your state, I'm going to highlight Georgia a little bit, but I want to orient you a little bit to the resources that are available. So whatever state you work in, there are these kinds of graphs that are available that you can download, grab numbers from. They're always updated with the most recent data. And so just starting from the left, HIV prevalence represents how many people living with HIV in a state in that year. And then breaking that down by men and women, breaking that down by Black, Hispanic, Latinx, and white, and by age group. The green panel shows the growth in PrEP use in that jurisdiction, and again breaks that down by sex, by race, ethnicity, and by age. And then on the bottom is this PrEP to need ratio, the sort of equity measure that I showed you, and we'll look in some more depth at this. New HIV diagnoses are in the blue panel. That's the third one over. And here in Georgia, we had about 2,400 new HIV diagnoses, mostly in men and mostly in Black Georgians in 2021. You can see this graphed out and related to the state to the region in the United States. And then for every jurisdiction, we also have an HIV continuum of care. And I won't walk through all these, but the data in the specific, but essentially we're looking at late HIV diagnoses, linkage to care, receipt of care in the year, and viral suppression. And these are a great place to go, again, for your educational activities with the community, for grant writing, for report writing. If you're going to be doing an interview, you can go and grab the latest statistics that are available. And then we have a series of other activities that are really meant to give some voice or some context to the data. As I mentioned before, some people love numbers, some people don't like them, and would rather hear in a voice that can more explain or put in context. So we have, for example, Q&A blog posts. Here you see one from Dr. Vincent Guillermo Ramos talking about the progress towards ending the HIV epidemic. We have these infographic panels, some of which you see here that really highlight different aspects of the epidemic and the response in Hispanic Latinx populations. And then this page in orange that says Deeper Look is a place where we sort of collect all the focused infographic panels, commentaries, anything that relates specifically to the epidemic among Hispanic and Latinx people, you can find in one place under this Deeper Look page. And these are all available on the website. So these deeper looks I mentioned before, and I pointed out the one on the lower right, HIV among Hispanic Latinx people. But we also have these same collections of data and articles about the topics you can see here: transgender people, criminalization, health equity, care continuum, ending the epidemic, PrEP. And so these are just sort of one-stop places if you're interested in understanding PrEP more broadly, or the status of what we know about the epidemic in transgender people living with HIV. And that one in particular highlights some of the lack of data that we have and unique barriers faced by the population. So I'm going to move now. I should have said up front, but I'll say now that if you have any questions, please just pop them in the Zoom Q&A box, and I'll be more than happy to answer those. I don't see any questions in there now, but I'll keep an eye out for them. If you want to save questions and you're more comfortable asking just with words like we used to do before Zoom, you can also save those, and we'll talk about them at the end. So I'm going to move now into talking about the PrEP use data that's available, focusing on Hispanic Latinx communities. So our goal with the PrEP data is not just to look at a national number of how many people are on PrEP and our progress towards national goals, because as we already talked about, you could imagine a situation where we have, 1 million people on PrEP or 2 million people on PrEP, but if they're not the people who are at greatest risk of acquiring HIV, then it's not going to do the most good for our communities and for our epidemics. And so what we really would like to understand is whether the distribution of PrEP users, here you see a map that's in shades of green from light to dark green, and this is the county level PrEP use that is depicted. I showed you before where the epidemic is. So the question we're asking is, does the PrEP use really line up with the extent of the HIV epidemic? So AIDSview, in coordination with IQVIA, which is a company that keeps data without identifiers about different use of different prescriptions, and this collaboration allows us to show PrEP use data and also stratified. So this PrEP use vary by age, by sex, and at the state level, we can also report these data by race, ethnicity. Next, I want to just mention the idea that we can talk about what percent of a population uses PrEP, and if we said in a city or in a state that among people who could benefit from PrEP, 30% of Black and 30% of Hispanic and 30% of white people in that state were using PrEP. That sounds like maybe that's a pretty even distribution of PrEP. But as I mentioned a couple times, we know that the risk of HIV infection is higher in Black and Hispanic people in the US. And so what we would like to see is higher levels of PrEP use in Black and Hispanic people. So this PrEP to need ratio is just a kind of statistic that lets us compare that, not just the number of people using PrEP, but the number of people using PrEP, if you're mathy, if you like math in the numerator, but the denominator is the number of people of new HIV diagnoses in that same group. So the idea is that we can compare Black, white, and Hispanic levels of PrEP use on a sort of apples to apples basis. And what equity would look like is if all three of those groups had the same PrEP to need ratio. In other words, their use is just right in line with their need. And what we see in reality on this little screenshot on the right is that on the bottom bar, which is the white for white Americans, that PrEP to need number is about 36. In other words, 36 white people using PrEP for every one new HIV diagnosis among white people in 2021. And the Hispanic bar is 9.2. 9 Hispanic people using PrEP for every one new diagnosis, and about 5 Black people using PrEP for every one new diagnosis. So we are way out of line in terms of equitable use. So how can you access these data and use them in your own work? This is again just a screenshot of the website. If you come to the website, you can just try one more time to find a pointer. Every time they update, go. Every time they update the, let's see if this is it. There we go. Every time they update Zoom, I lose my tools. So if you come to the website, you can like look at this area and drop down to see Black, white, or Hispanic communities. And up here on the top, you can ask to see HIV prevalence, new diagnoses, deaths among people living with HIV, pre-exposure prophylaxis, or this PrEP to need ratio, testing, late diagnoses. So really everything about the care continuum you can see mapped specific to, for example, a specific racial and ethnic group at the state or county levels. So is ethnicity reported in mutually exclusive categories similar to SEER? Yes. These are the same categories that we use in SEER. Thank you for that are used in SEER. Thanks for that. All right, so and then you can also pick whether you want rates or counts of users and the year. So you can sort of make your own map here based on what your interests are. So here I've selected PNR. This is the PrEP to need ratio. Keep in mind that the darker colors here are going to indicate states in which PrEP use is more equitable for Hispanic people. And just as a general sort of rule, we see that it's states largely in the South that are in that lowest level of equitable PrEP use. And some places like the Pacific Northwest are substantially better in terms of their PrEP equity. We can also look at these same kinds of data in state profiles. So here we're focusing on Minnesota. If you wanted to get this kind of view, you'd go to local data, and then you can pick state, and then you can pick Minnesota, and you'll be able to find this in other infographics. But if you, for example, want to know how many people were using PrEP in Minnesota in 2022, we have that number broken down by male and female, by race and ethnicity, and by age. You can see the trend. And then similarly, the PrEP to need ratio. And this PrEP to need ratio that we see in Minnesota is actually even more inequitably distributed than we saw in the nation as a whole, because we have nearly 80 white people on PrEP for every one new diagnosis, but only a tenth of that, about 8 Hispanic Latinx people on PrEP for every new HIV diagnosis among Hispanic Latinx people. I just have to say, as someone who's worked in public health and in HIV for decades, that the epidemic has always been characterized by inequities in health, but these inequities in response that are tenfold, serving populations at 1/10 the level or 20th the level in one community versus another are just really astounding from a point of view of opportunity for the public health system. So overall, PrEP use in Hispanic Latinx populations, Hispanic Latinx individuals had the lowest rate of PrEP use per 100,000 among other races, although Hispanic Latinx people account for nearly a third of new HIV diagnoses. So these are per 100,000 population in 2021. And you can see that white and Black Americans have fairly similar levels of PrEP use. Again, although Black Americans have much greater risk of HIV, so here equal isn't equitable, but Hispanic Latinx populations have both lower rates and a lower PrEP to need ratio in terms of equitable PrEP use. So if we look at this graph, which I looked at in a little version, this just shows race-specific PrEP to need ratios in 2022. And overall, the PrEP to need ratio among Hispanic Latinx individuals is, you could think of it as 4 times lower, or only about 25% as high as the level in white individuals. And this means that the unmet need for PrEP in Hispanic communities is considerably higher. And we need to do a better job, not just of getting people on PrEP, but getting Hispanic, Latinx, and Black people on PrEP. So there are other PrEP resources on AIDSview, and I just want to highlight them. Of course, in the end, like the way I feel like I can contribute to ending the epidemic is with data, and that's why I spend so much of my time trying to work on data resources and share them with people. But in the end, prevention will happen because of connecting people with prevention services and connecting people living with HIV with medical care. And so on the left here, we have service locators that include at the top HIV testing, PrEP, HIV care, stigma reduction for the U.S. South, overdose prevention and reversal, harm reduction, and trauma-informed care also in the South. And here's a picture of DC where all of these represent PrEP providers. And you can change those settings on the top to look for a testing location that's nearest to where you are or where your client is, care, etc. We also have a number of these Q&A blog posts that are focused on PrEP, and we really try and bring in voices that speak to different aspects of both the clinical aspects of PrEP, but also these issues of PrEP equity. So here you see a couple of those this year, Dr. Rashida Chandler on PrEP and Black women. And in 2022, Alicia McKinley Beach on the past, present, and future of PrEP. And you can sign up and get notices when new blog posts become available. And then I mentioned before the deeper look pages. This is sort of a one-stop shop on the AIDSview website where we'll compile all of the data, the infographics, the Q&A blog posts, and links to the data sets so that you can focus on what you want to focus on. So I'm going to stop at this point in the presentation and see if there are questions either about how you might use the data or kinds of data that you think would be helpful, but we don't currently have available, or any other questions about the website and what I've presented. And I'm going to try and stop sharing so I can see you.
Thank you very much, Patrick, for your presentation. Always amazing to see how AIDSview is continuously producing and improving and getting more information about things related to HIV. That new the new rate that you presented, need PrEP to need or something like that, incredible. Like it shows how much we are behind where we have to be. There's a lot of work to do. So
Thank
please,
you.
just write your questions on the chat box or in the other box answers, so we can. Mm, questions. Is there anything new coming up soon for AIDSview? Any new report and new because every year there's something new with AIDSview, right?
Yeah. So we do update the data every year to be the most recent, and we'll also be updating new PrEP numbers. We're also going to be launching data within cities. So I sort of talked about the different levels, and not all the data launch at the same time, but this year we'll be updating the data within cities in November. And so one way to like keep up with what's being updated and when there's new data is you can just go on the website and sign up to receive updates, and then we'll if there's a new blog post or there's new data available. So the data come on slightly different timelines, and you'll notice sometimes we have 2022 data for one part and 2021 for the other. But the next big launch for cities will be in November, and then around the awareness days, I don't know. I might see if I can stop screen sharing. I'm not screen sharing now, correct? Just gonna pull up because I'd also like to just show people um, where to find on the website these. I'm going to share here. So this is just a view of AIDSview, and I can point out here that if you want to use these infographic panels, these are the deeper look pages I mentioned, but you can also just go to infographics and choose what you're interested in. So we can just choose Hispanic, Latinx, Americans, and these are all the sort of slide decks that have been posted, so you can look through these or download them. And these may be things that you can share on social media. Just gonna see if this will open up for me. Um, you could share these on social media to make sort of a point about an educational point. Are you able to see the infographic here?
Yes, yes, yes.
Okay, so you can sort of look through these and just and see what might be useful. You can take and use these images any way you want in a slide presentation, share them on social media with a comment, and just I think it's such a concern to me now that we not lose that we not sort of lose our focus on the HIV epidemic, and that it's still that it's still in our communities and still an important priority. And I think probably a lot of the uh, uh, colleagues that are on the call today are important voices in our communities to be able to just put something up as a reminder that that HIV is still a pressing problem, that every year people are you know, acquiring HIV and living with HIV, and that we can do more with PrEP to try and prevent those. So I think these are small ways sometimes, but I am always surprised when I post things on my social media how much response I get and how much people appreciate just being reminded. So I think that's something that we all can do.
And
Um,
if after you
so,
show also from year to year, we can see progress, the changes that happen.
yeah. So I see a question from Annie. Thank you, Annie. Self-testing has just become legal in the state of Kentucky. Is there a way to gather data regarding where self-tests are being sent or ordered? Of course, we know there needs to be a follow-up confirmatory test. We're wondering how to use these data on self-tests to help prevention efforts. This is a really great question. So right now, there's a couple things that are in play. And Annie, I'm happy to follow up with you, and we can reach out and make sure we're connected. But so there are a few places where there are data about where self-tested are being sent and ordered. One is CDC has a new national free HIV self-test program that's called Together Take Me Home, TTMH. And that's CDC supports this with public health money, and anyone can go on and order one or two test kits to be sent to their home. And so we do have data already coming in from where those kits are being ordered from. And and if you follow up with me, I think, for folks, for public health, oh, good. Okay, great. So you're already working on that. Beyond that, the other source of data that there is available is particularly for Kentucky, would be that there's a national survey that's specific to men who have sex with men, and another one specific to trans folk, that asks about use of different kinds of testing services. And that's led by Dr. Travis Sanchez at Emory. And I know that their data reports broken down by state are available. So when we follow up about this, if this is not already out publicly, We can also share with you the last few years of data about men who have sex with men and trans folk who report being tested with a self-test to get an idea of the proportion. And if you have any trouble, our TTMH colleagues are wonderful. If I can be helpful in any way beyond, I'm not as wonderful as them. So, but if I can fill any gap, just in communication or whatever, please let me know. The other thing I'll say about self-test is, I think as public health folks, we want to be able to understand the extent to which people are tested, and we want to understand negative tests as well as positive tests. And in the case of self-testing, we particularly want to know that people link to that confirmatory test and into care. But I also think that I grew up in Tennessee, so I'm a neighbor. Um, and I think that the self-tests are a really important outlet for people for whom it may be too high a step to go in and ask for HIV testing, or maybe even to accept it. And I think in research studies we have seen that people will use a rapid test and maybe use another one, and that could be a gateway into connecting with healthcare, whereas they never would have taken that step to get into healthcare. So I think our metric for self-testing needs to just understand that part of the goal here is to reach people who otherwise aren't going to walk into a brick and mortar facility. Maybe they've had a bad experience or a disrespectful experience, or been misgendered, or been, somehow in other way not had a good experience. And self-test may be the way to get them back into that pattern of self-care that leads eventually back into other kinds of care. Yeah, thank you. And I'm going to grab your email right now so I can follow up. Thank you, Annie. Any other questions? You can either unmute, I think, or
You can ask them to unmute them. I will unmute them.
Oh, okay. Yeah, if you ask.
Yeah.
Okay.
Question about PrEP. PrEP data do you have? Is that only for just PrEP in general, or you can have, now there are so many ways to take PrEP, right? Like injectable by mouth.
Yeah, yeah.
By mouth, it could be on demand, or it
Um,
could be every day.
so really up until now, what we get is the data on essentially the prescriptions that are filled, not with any personal information, but just like that here's a person in Kentucky who got this pattern of refills. And because daily oral PrEP was really the only approved way, we could make some assumptions about what that meant. Now, for long-acting injectable PrEP, we actually are getting data and trying to figure out how to make sense of it. So we'll be able to represent that as long-acting injectable PrEP. What's a little bit more difficult is if someone is getting a prescription of 30 pills of PrEP once every 3 months. Does that mean they're meaning to take daily oral PrEP and forgetting to take it 2 days out of three, or does it mean they're using it as 211 PrEP, this sort of event driven PrEP? And so I think we still have to develop some new methods, because it's great to be able to get data, but to protect people's privacy, which I'm all for, it means that we don't get some other data that would help us understand like how are intending to use it, and whether those 4 pill prescriptions a year means they're 100% covered with PrEP because they're using it 211 every time they have sex, or maybe it means that they're not fully covered. And so we'll do some more work on how we understand that. It's a great question. I think that I was just going to say the corollary of Annie's question is, how we link people, because counseling and testing is a really prime opportunity to let people talk about their concerns about HIV, or share about what their risks might be, and then get some advice about steps they might take to protect their health. And certainly, I think PrEP referrals often come out of HIV counseling and testing sessions. So the other corollary to what Annie asked about is how we serve people who may be ordering HIV tests to take at home, And I know when these came out, one of the concerns was that we were missing an opportunity to talk about other prevention methods, condoms, PrEP, other kinds of prevention. And I think in the end, the public health benefit of letting people screen themselves for HIV, people who might not be comfortable going in for screening, is outweighs this idea of missing a chance to talk to some people about PrEP. But I do think we have to be thinking about what are the tools that we could give people. So let's just imagine that this test comes, and in that, there's already information that links out, but imagine there were a QR code to a little self-assessment tool that could link someone up with a PrEP program, or a video that gave them some information. So some of these things are already underway, but trying to figure out from a scientific point of view what helps people assess their PrEP eligibility and interest the best after a home test, I think is another area we're going to need to work on.
Also, when you mentioned the importance of self-test, people um, don't want to go to be tested because of the stigma. That's also very one of the main
Mhm.
things that happen in our community, Latino community. The stigma is very strong because of fear to be called any of those behaviors that are related to being HIV positive.
Yeah.
Any other question? Any more questions? Well,
I'll say one more thing, which, and maybe we can put it in the chat to everyone, which is if you're interested in using these data, or if there was something that seemed like it might be useful to you and I went too fast, people can just email us at info@aidsview.org, or patrick@aidsview.org, or go on the website and contact us. And we really we're fortunate to have resources for colleagues who can help you figure out what data might be most useful. So if it's I'm writing a grant about to CDC about this in my state or in my city, can you help me figure out what data, and how to put those pictures into the grant? Like, we can really help with all that kind of stuff. And we feel really fortunate to have great colleagues and resources that, because we're excited about these data and how they can be used to help end the HIV epidemic. But we also know that not everybody sits around all day thinking about the technical aspects of data and which statistic to use. So we're here to help with all of that. You can always, we are so proud and grateful for our partnership with the Latino Commission. And so our colleagues at the Latino Commission know how to reach us for sure. So if you want to start in a conversation with them, if you want to reach out to us directly, we're here jointly with the Latino Commission and other public health partners to end the HIV epidemic. And the way that we can contribute is with data. And we're passionate about that. And we'd love to help you see if there are things that you could use. So reach out anyway, and you'll get to our team. And we're here and eager to help.
thank you, Patrick, and thank you, FB, for the amazing work that you do with data that provides us information, necessary information, not only for grants and things that we do, but the government to focus on resources for those areas that need more attention. So thank you again. We love to have you every year here showing us updates on FView, and if you always become amazing partner with us. So thank you everybody to was here today with us. We have one more webinar and on the 12th. And it's going to be with Montefiore Hospital from New York City. So see you then, and thank you, Patrick, again.
Thank you.